Well, today we are talking about knees and the aches and the pains that come along with them. We certainly know about that. Joining us today, Dr. Richard Busch from Busch Chiropractic's Pain Center. And Dr. Busch, a lot of people can relate to this topic today. Tell us a little bit about the common ailments associated with the knee.
Well, as far as knees are concerned, there are a lot of different structures that we have to deal with. First of all, we've got the femur on the top and the tibia on the bottom, and then the fibula down here. But then along with that, we also have the ligaments that are actually the things that hold the bones together. And then we've got the tendons, which actually hold the muscle to the bone. And then along with that, we've got some little things called bursa, which are actually little fluid-filled sacs that help allow those muscles and tendons and everything else to move over the top of each other. And then along with that, we've got this little piece in the middle. This is called the meniscus. You might have heard about people tearing a meniscus, and a lot of times they'll have a surgical repair of that type of thing. And so these are all things that can cause the pain. As far as the pain is concerned, it can come from any group of these types of things, and with wear and tear, that meniscus over time can wear out, and that's where people start to talk about having bone-on-bone types of problems.
And obviously a lot of moving parts there. What are the things that you can do to alleviate that pain?
Well, first of all, we're using different types of lasers, which actually help increase the blood supply and oxygenation to the area, and it also helps increase the function and the energy that those cells have in there, so that it actually spurs a healing process, which is very important. You know, we've always known the body can heal itself if it's given the proper situation, and that's really what we're doing. But we're also using some different types of, you're probably familiar with ultrasound.
Yeah.
Ultrasound actually spreads out inflammation into different areas, and what we're actually using is a specific type of ultrasound that helps send a shock wave to a specific depth, so we can break apart scar tissue, adhesions. Adhesions are little things between muscles and even the fascia, which is the little things that allow the muscles to slide over the top of each other. So we can break that stuff apart, and then also it stimulates stem cell production in the area. You probably have heard about stem cells, but stem cells help things heal. We make stem cells until we die. And as far as that's concerned, this actually stimulates the stem cell growth in the area, so it actually forces your body into a healing process. And then along with that, we're also using, I know that you're familiar with the DRS program because we use that we talk about that a lot. But what that does is it allows us to pull the disc level apart, and that helps increase the oxygenation to the disc. Well, we're also using a specific type of treatment that helps move the joint so that we can help increase the synovial fluid. The synovial fluid is the fluid that allows things to move smoothly over the top of each other in joints in your body as well.
Well, it's such an important topic because so many people can relate to it, and if you start to feel that pain, you don't want to wait around. It's not just going to go away. You got to treat it.
It progressively gets worse, and it changes your quality of life.
Absolutely. Dr. Busch, thanks so much
Thank
for
you, sir.
that information. You can find out much more about knee pain and the aches by just visiting the website buschchiropractic.com.